complete breakdown of the nervous and immune system is different for every person. Clearly, toxins are a big issue, but they're not the only factor. So I'm going to touch on toxins just for a couple of minutes because it's been discussed so much today, and a lot of my work involves taking toxins out of people using chelation therapy and infrared treatments and supplementation and advice about how to avoid toxins in the environment. So there are basic routes of detoxification that we try to enhance. One path of elimination is stool. So we try to make sure that your gut is healthy, you're taking probiotics, you're having a good bowel movement every day, and if the gut isn't working properly, that's a primary priority. Next, we know that the elimination of toxins often involves the liver, and so we often use supplements and other strategies to help make sure the liver is detoxifying properly. These include things like healthy fats, coconut oil, nuts, avocado, if you're not sensitive to them. Herbal medicines like milk thistle, alpha-lipoic acid, selenium, vitamin C, etc. All of the orthomolecular approaches. We know that we eliminate through the kidney, so we try to encourage an alkaline urine, mostly a plant-based diet. There are charts on the internet that tell you which foods are more alkaline and which are more acidic. And this is based on the amino acids in the foods. And it affects how you're able to eliminate toxins. And then finally there's sweat, which ideally you would eliminate through exercise. But if you're not able to exercise because you've got adrenal fatigue or you've got other challenges that prevent you from really exerting yourself to the point of sweating, then there are a wide range of sauna therapies and lymphatic massage techniques, whether you're rebounding, jumping rope to get the lymphatics moving. That's an important route of detoxification. And then there are the metals, which are difficult to get rid of without help. So there are oral and intravenous chelation substances which bind metals and help you eliminate them. This is still an area of controversy as it relates to environmental sensitivity, but many people with environmental sensitivities don't just have a problem with having too much metal. They are actually allergic to metals. So we recognize nickel allergy as the reason why some people are allergic to cheap jewelry. But we now know that many people are allergic to mercury, gold, aluminum, and other metals. And one of the things that happens to your system, we're not sure exactly why, but when you're suffering from environmental sensitivity and you're constantly having these reactions, your nervous system is stuck in a fight or flight mode, sympathetic nervous system, which constricts all of the small blood vessels in your periphery. So when your fight or flight system is on, it's because a million years ago you were running from a tiger or chasing prey. So that wasn't exactly the time for you to be detoxifying. That's the time where you want to have more blood supply going to your heart and muscles, and probably less to your detox organs. So as a result, people who constantly have this reaction happening because they're reacting to things in their environment aren't detoxing properly. As far as physical wounds are concerned, this is a very important issue. And I'll begin with a brief overview of the dental and orofacial aspects that might predispose to multiple chemical sensitivity. Because although many of you at some point in your lives have been told by someone in the medical profession that it's all in your head, in fact, part of the dysfunction is in your head. It's not imaginary, but it's involving nerves above the neck. So there are a few key injuries that can occur as a result of dental work that I think it's important for me to at least mention, because you may not hear it anywhere else. Keep in mind that these are still considered controversial, but in clinical practice we found them very important. Many of you have probably heard about the potential risks of amalgam fillings. We know that the mercury in your fillings evaporates. You inhale that vapor, and it gets absorbed into your alveoli in your lung, it gets into your bloodstream, and from there it finds its way into the nervous system. We also know that a lot of the mercury that evaporates finds its way to the olfactory bulb, which is the nerve that controls chemical sensitivity to smell. And the levels of mercury in the hypothalamus in animal studies have been shown to be 30 times higher than in other parts of the body. So amalgam fillings are now being banned in some Scandinavian countries. In Canada, we have guidelines that limit their use, particularly in children and pregnant women. But most of the guidelines that are lagging are not lagging because of scientific reasons. They're lagging because of, as Dr. Sears pointed out, pragmatic concerns. So they cannot upset an entire population that has mercury in their mouths. So they have to be judicious about how they convey the message. But many of our patients have opted to remove those amalgam fillings. And with the uncontrolled studies that have been done, about a dozen or so, the overall response rate is about 80% of patients who've had their fillings removed and ultimately find that their symptoms did improve. How much of that is placebo effect, those studies can't answer. Other dental factors that can irritate the nervous system include having wisdom teeth removed when they're impacted in the bone. Impacted wisdom teeth create an inflammation in the pocket of the bone. And when they cut the gum open to remove them, the bacteria that infest the mouth can get stuck in those pockets. They're called cavitations. And they lead to tiny areas of what we call osteomyelitis in the bone. Not enough infection to create a huge problem, but enough infection to create a permanent state of alarm in the nervous system. Root canal procedures can lead to the same problem. When you have a root canal drilled, you can get a few bacteria that get lodged into that hole. And when you cover it up with dental material, that can create a localized infection that can sometimes be seen on an X-ray as an abscess. Sometimes it's not visible on an X-ray. And finally, bridges that cross the midline are recognized by therapists who do what we call stomatognaathic medicine, which is that overlap between the teeth and the craniosacral nervous system. Basically, you have a fissure across your maxillae, the two bones in your upper jaw. And that fissure is supposed to have a very subtle movement with respiration. Almost imperceptible, but real and important for the nervous system. If you have a bridge that crosses the midline, that can create a barrier to that movement. And it can create sympathetic stress for the nervous system. Many people who have wires in their mouths, those wires are made of stainless steel. Stainless steel contains nickel, which is a common allergen as well. So being aware of this interplay between dentistry and medicine is something that we haven't recognized in Canada or in the United States, and it's a really, really important factor. Most of the doctors who do the kind of medicine that I do, where we see the patients who have seen everyone else and haven't been able to get well, recognize that many of these patients have obstacles to cure that involve